July is National Sarcoma Awareness Month. Sarcoma is a form of cancer we don't hear about much, so KCTV5's Carolyn Long sat down with a specialist with HCA Midwest Health to find out more.
You know, we hear so much about breast cancer and lung cancer and even brain cancers, but sarcoma we don't hear much about. Why is that?
Carolyn, that's a great question.
Dr. Suhel Kotwal is an orthopedic surgeon at Menorah Medical Center. He says most of us are not familiar with sarcoma cancer because it is rather rare. That's why it's even been dubbed the forgotten cancer.
Sarcomas are cancers that originate from certain specific type of tissues. They include bone, soft tissues, joints, muscles, blood vessels, and fat. Basically connective tissue, and these are sort of rare as compared to some of the other cancers. They amount to about 1% of all the cancers, but they affect right from a child to an elderly person.
Wow. Okay, so if it is so rare, how do we know to be worried about it? What are some signs or symptoms of it?
Well, good question, Carolyn. Most important symptom patients feel after they have a sarcoma in their body is pain. They will start getting aches and pains in joints. Unfortunately, we do get aches and pains in our joints and we tend to neglect it. And if you have pain like that, that is persisting, pain out of proportion, pain that is not controlled with your basic over-the-counter medications, it's important to make sure you check it out with your doctor. That is the most common symptoms. There could be other symptoms like lumps and bumps in the body that are not going away. There could be weight loss, night sweats. There could be loss of appetite, blood and stools and urine, etc.
What is causing it? Is there anything we can do to, get ahead of this one?
Unfortunately, Carolyn, we don't know what causes sarcomas. There are some predisposing factors like existing conditions of bone and soft tissues from before, post-radiation therapy, certain chemical agents. Some of these could be genetic. Unfortunately, we don't really have a handle of why these things happen, but once they do happen, it's important to get them checked out rather rapidly.
Once diagnosed, then, is the treatment somewhat similar to other cancers?
It is drastically different from other cancers. That's why it's important to know how to diagnose these cancers and treat them accordingly. Hence, there are specialists specially dedicated to this type of cancers. The treatments include chemotherapy, radiation, and various kinds of complex operations and reconstructions that needs to be done to get rid of the body of cancer.
Dr. Kotwal, thank you for joining us this afternoon.
Thank you, Carolyn.